Good afternoon, all of you. Actually, we are just one session, that is one talk before the lunch. My talk is related to autonomic awareness, which is a suggested by Dr. Bansi, and there are some 2 slides. And kudos to Dr. Bansi and the entire team, Rutul, Pradap, and Vitul people, entire team for this wonderful conference. And my greetings to all my fellow speakers and the chairpersons. And Thiruvalluvar is a famous saint poet and Tamil poet. He is author of Tirukkural. He has given one couplet, that is Noi Nadi, Noi Mudal Nadi, Adu Tanikum Vai Nadi Vaipachayal. When you translate, diagnose a illness, trace the cause, seek the proper remedy, and apply it with the skill. This thing is very much applicable to all the patients sitting in front of us. That too, which is applicable for the detection of the ANS dysfunction. Introduction. Failure of the ANS regulation, both the sympathetic and parasympathetic, it is very important because it is underestimated. And morbidity and mortality can mimic the anxiety or functional disorders. My topic is a vast one, so I am rushing it. Central control hypothalamus and the brain, sympathetic thoracolumbar outflow, parasympathetic craniosacral outflow, and the important neurotransmitters, acetylcholine and norepinephrine. Causes mainly primary cause, multiple system atrophy or pure autonomic failure. What about the secondary one? Diabetes and Parkinson's and other disorders. Clinical manifestation, it involves all the system, affect all the systems, cardiovascular, gastrointestinal, genitourinary, pseudomotor and ocular. Some challenging clinical scenarios. There are around 8 to 10 clinical scenarios which are very much challenging. So due to want of time, I just give some 2 to 3 points for each scenario. That is, one case is orthostatic hypotension and supine hypertension. When they are coexisting, management is a major challenge. And silent myocardial infarction. Another scenario, diabetic patients with the cardiac autonomic neuropathy, the damage to nerves can lead to painless myocardial infarction, where a heart attack occurs without typical symptoms like chest pain. This is very, very important. Many of our patients who come to our day-to-day clinical practice, they have the same problem. There is no pain, just they feel it is acidity and all those things, and land up in some native medicine, then they end up in the worst scenario. When the parasympathetic innervation is affected, there is a resting tachycardia. It is a dangerous one. Diminished heart rate variability and exercise intolerance. It is one of the another dangerous thing, and fatal arrhythmias. When the same patient, when there is a sympathetic and both the parasympathetic innervation is affected, you have a orthostatic hypotension, silent myocardial ischemia, and supine hypertension. What about the exercise intolerance and tachycardia? When there is a impaired cardiac response to exercise, impaired blood pressure response to exercise can lead to severe exercise intolerance. A persistent resting tachycardia, fast heart rate, further complicates the management. Another case scenario, severe GI and bladder dysfunction. Patients may face significant challenges with the severe constipation, frequent stools, impaired gastric emptying, or a neurogenic bladder leading to incontinence and urinary retention. This is a common scenario we come across in our day-to-day practice. And complex sexual dysfunctions, both male and female patient can experience severe sexual dysfunctions, erectile dysfunction, ejaculatory problems, decreased lubrication. Many patients that complain all other complaints, but the patient, he doesn't complain the erectile dysfunction. We have to sit with the patient and inquire about this, unless otherwise he will not disclose it. Autonomic dysfunction in the elderly population is a dangerous one. That is, conditions like after COVID, they can develop severe orthostatic hypotension, anhidrosis, and electrolyte imbalance. And challenging another clinical scenario, increased risk during the surgery and anesthesia, covered by my previous speaker, and limited reversal of neuropathy. Current strategies for reversing the autonomic neuropathy are limited. So we have to recognize this condition, diagnose the condition, address the symptoms. Symptomatic management is the only cause, only thing in front of us. There too, more symptoms, multiple symptoms are there. Then again, also it is a challenging one to manage. So diagnostic challenges, bedside test, heart rate variability to deep breathing, Valsalva, and tilt table tests are helpful in our day-to-day clinical practice, that is bedside testing. Management, lifestyle, posture training, salt, compression stockings, cardiovascular, it involves a multidisciplinary team. GI, dietary modification, we can go for it, prokinetics, small frequent meals, and for the genitourinary, bladder training is very important. And what are the case pearls, learning points? Autonomic dysfunction is common, very, very common, but overlooked, under-recognized, under-treated. Presentation, they vary across organ system, all the organ systems. Diagnosis requires suspicion plus targeted testing. Management is individualized and multidisciplinary. Future directions, we may go for biomarkers research, imaging of the autonomic nerves, and technology we can use in the future. We may have AI-based ECG analysis, CGM integration for autonomic tone, and wearable monitoring. Bedside autonomic testing is still useful to study the autonomic neuropathy. So conclusion, autonomic dysfunction, it is challenging, but it is manageable. You have to recognize, you have to diagnose, and you have to go for individualized therapy. Increased awareness is needed, which improves outcomes. To conclude, autonomic neuropathy is widely prevalent in diabetic patients, and when you want to recognize and diagnose, you have to go for a careful history taking and clinical examining. It will give you clue to diagnose autonomic neuropathy. Bedside clinical test of autonomic neuropathy will support the clinical diagnosis. To confirm the diagnosis and research purposes, variety of the medical instruments are used. Finally, to conclude, again the famous saint, this kural is very much applicable. Varumunnar kavadan valkai, yerimunnar vaituru pola kedum. What is it? A life that does not guard against oncoming flaws would vanish like a heap of straw before fire. Thank you very much for the patient listening. Thank you, bye.